Okay, hi everybody. I'm going to be presenting over the epidemiology and prevention of African sleeping sickness. So, so first off, we have the epidemiological statistics. So, prevalence of African sleeping sickness in the study population, which is mostly in Central African countries, it's about 0.3%, which is about 25 out of every 8,556 cases. There was an estimated 300,000 cases between the 1980s and 1990s, but since 2009, there has been a steady decrease in newly reported cases, resulting in a drop to nearly below 10,000 cases. So that is a significant drop within a few decades. So the incidence is approximately 60 million people in 36 sub-Saharan African countries are at risk for contracting African sleeping sickness. And the mortality rate when left untreated is almost 100%, which causes it to become fatal. So next we have patterns of disease. So African sleeping sickness is an endemic disease with many reported cases in the past 10 years. This disease is called by a protozoa parasite via a vector known as the tsetse fly. So African sleeping sickness currently does not have a vaccine or medications that prevent the disease. And they don't really plan on coming out with a vaccine anytime soon. This is because the trypanosomes within the disease have evolved a system to evade the host immune system by varying their structure of their surface coating. So they're constantly evolving, constantly changing, therefore haven't been able to develop a vaccine. Travelers to any of these sub-Saharan African countries can protect themselves by preventing bites from the tsetse fly. Some preventative measures pertaining to the CDC is they require protective clothing, so like long sleeves and pants, because they're pretty thick material. Neutral colored clothing. This is because the tsetse flies are really attracted to bright colors. Inspection of vehicles prior to movement or turning them on. This is just because they accumulate in tight spaces. Avoid bushes. If you're out in these wooded areas, they won't really come at you immediately unless obviously you bother them. So just avoid any bushes, trees, things as such. Using insect repellent to repel other insects. This is just common knowledge, insect repellent. Treatment for African sleeping sickness varies, but for the most part, a person's treatment is based on their lab results. Hospitalization is usually necessary when infected. Medications for treating African sleeping sickness is almost always available through the CDC, and periodic follow-up exams are required for at least 2 years after infection, which include a spinal tap every single time. Lastly, we have some images and tables. This picture here on the far left is a picture of the tsetse fly. These are the vectors that cause infection. In the middle, we have a statistical graph that shows just a range of infected cases ranging from 2011 to 2020. And then lastly, on the far right, we just have a table showing some common signs and symptoms of African sleeping sickness to help identify things such as headaches, fever, enlarged lymph nodes, muscle and joint pain, rash or itchy skin, a large sore at the site of the tsetse fly bite, things like that. So thank you so much. I hope y'all learned something.